Hello, I am Nurse Ngozi from EhieduFoundation. In this video, I'm going to talk about breast cancer, the risk factors, the signs and symptoms, and what you should do when it comes to the treatment of breast cancer. Now, I'm going to talk about the risk factors under two headings: the fixed risk factors and the modifiable risk factors. Now, for the fixed risk factors, these are factors that cannot be changed. These are factors that are naturally occurring, and they include age. Now, the older a woman or a man gets, the higher the risk of breast cancer. Number two is gender. Now, breast cancer is mainly common in women. Number three is menstrual history. Now, it is believed that early menarche and late menopause are actually risk for breast cancer. Now, the next point is hereditary and genetics. Now, the risk for breast cancer is higher when a person has relatives, that have already suffered from breast cancer, like a mother or a sister or a cousin that have suffered breast cancer. The risk for breast cancer for that individual increases. Now, let's talk about the factors that are modifiable. Now, these are factors that you can change through lifestyle changes. Now, the first one we're going to talk about is smoking. All right, smoking is actually one of the risk factors for breast cancer. Another point is obesity. So obesity is one of the risk factors for breast cancer. Another point is the diet. What kind of diet are you taking in? It's actually very, very important when it comes to breast cancer. If you're not eating healthily, it can actually lead to even any other cancer, but yes, breast cancer too. Another factor that's very important is sedentary lifestyle. Now, what this means is you're mainly at one place for a very long time. Your activity level is not high, is very low. Now, this is actually a risk for breast cancer. Yes, signs and symptoms of breast cancer: changes on the skin of the breast, pain, unusual pain on the breast, or a lump on the breast. So if you notice any of these things, make sure that you talk to your healthcare provider so that further investigations can be made. Now, how is breast cancer diagnosed? Usually, if you notice any of these signs and symptoms, you go to the hospital and then your healthcare provider examines the breast and then goes further to do investigations like a mammogram. Yes, this is actually very, very important. A mammogram is done, which is a scan of the breast. This is done to see the breast tissues and to see if there are any cancerous cells or anything abnormal in the breast in general. All right? Yes. Now, one thing about breast cancer that's very, very important is early detection. Early detection is important, and that is why breast self-examination is very, very important. We're going to leave you with pictures on how to do breast self-examination. Now, this means you're actually going to examine your breast by yourself. For women that are still seeing their periods, that are still in the reproductive age, it is usually advised that they do this at the end of their period, like few days after their menstrual period. Now, for women that have passed for menopausal women, that is, they no longer see their period, you can actually do breast self-examination at the beginning of each month. Now, our partner hospital, Lily Hospital Limited, is actually giving out a special promo for mammogram and cervical screening. So on the last Saturday of every month, you can walk into any of our branches, whether in Warri or in Benin City, and then have a mammogram done. So for every last Saturday of each month, you can walk into our branches in Warri and Benin City to get a mammogram and a cervical screening done for 18,000 naira. This is actually a 50% discount and should grab it. Yes. In the next slide, we're going to show you how to perform a breast self-examination. Thank you for watching this video, and make sure to subscribe to this channel for more information on health, advocacy, and empowerment for the girl child and women. Also follow us on LinkedIn and Facebook with Ehiedu Development Foundation. You have a very nice day. Bye.